Hello and thank you for tuning into this Radiology in a Minute video. I'm going to spend the next couple minutes talking about this very cool study which looks at the use of digital breast tomosynthesis in breast cancer screening and how this changes over time. A bit of background to start. So digital breast tomosynthesis, or DBT, is a test that's rapidly gained ground for breast cancer screening because of its superior accuracy and lower recall rates compared to digital mammography alone. It produces a 3D reconstruction with a stack of thin 2D slices, which is meant to minimize the influence of overlapping breast tissue compared to digital mammography alone. There is a question, however, of whether a prevalence effect may occur with the first round of DBT screening for cancer detection rate and false positive results. So the purpose of this study was to assess whether the improved screening performance of DBT persisted after the first round screening. A retrospective single-center trial was performed assessing breast cancer screening before the implementation of DBT, as well as in a 5-year period after the implementation of DBT. There were almost 100,000 digital mammography examinations included in the study, as well as over 200,000 DBT examinations. The performance of digital mammography alone was compared with DBT, but also there was a comparison done in patients who had no prior DBT examinations versus those who had at least one prior DBT examination. The outcomes assessed were the cancer detection rate, which is the number of breast cancers detected per 1,000 patients screened, the abnormal interpretation rate, which relates to the overall recall rate as well as the number of false positive examinations, the positive predictive value, which is the proportion of true cancer cases detected among all positive result examinations, as well as the sensitivity and specificity, which are measures of diagnostic accuracy of these tests. In comparing digital mammography alone and DBT, there were no differences in overall cancer detection rate. However, DBT demonstrated a lower abnormal interpretation rate, which translates to a lower recall rate and lower rate of false positives. DBT also had a higher overall specificity compared to digital mammography alone. Cancer detection rates were maintained after the implementation of DBT, with the highest cancer detection rate observed with a woman's first DBT examination compared to subsequent ones. In summary, while there was no difference in cancer detection rate between digital mammography alone and DBT, DBT demonstrated a lower false positive rate and higher specificity, which may reduce healthcare spending and resource utilization. And the highest cancer detection rate was observed in a woman's first DBT examination compared to subsequent ones. Thank you so much for tuning in. If you'd like to see more, follow me on Twitter.